Everyone to the next episode of the first season of the FIP Chief Executive Officer Interviews. Today, I'm delighted to welcome Emer Cooke to the interview chair. Thank you so much, Emer, for making time for us in your busy agenda, especially during these strange COVID times we're living in. I wanted to welcome you to our first season of the FIP CEO Interviews, and you'll know we're running 10 such interviews in this season with global leaders and colleagues in pharmacy and healthcare. In the interview, we want to chat to find out more about your journey, your experiences, and the impact those experiences have had on your professional practice. And I was inspired to start these discussions after the FIP president, Dominique Jourdain, and myself were having a discussion with Professor Trevor Jones around the development of a vaccine and treatments for COVID-19, issues very close to your heart, Emer. Trevor walked us through his experiences with AZT in the 90s and how invaluable those lessons have been for right now. The thing was, Emer, not only was Trevor so open about what had gone well, he also shared what hadn't quite gone to plan. And it made me reflect on how important it is for our pharmacy leaders to be able to share such insights and the experiences, not just when things go well, but when they go less well. So, Emer, I'm so proud to interview you today in the first of the season, and I can't wait to share some of those insights and learn myself what you have to share. We'll take about 30 minutes of your time, but Emer, welcome.
Thank you very much, Catherine, and it's really a pleasure to be here. I'm very inspired by working with FIP. I've had a lot of interactions with FIP over the years in various different iterations. And I think this idea of having an interview with different characters, let's say, it's a really good one.
Oh, thank you so much, Emer. I think before we get to the professional elements of the interview, I just wanted to walk the listeners through a little bit of your background, but really to start from the beginning, Emer. So I note from your biography and from some speedy research I've done, you're an Irish national, currently Director of Regulation and Prequalification Department at the WHO, and that position you've held since 2016. In this role, you lead on the global work on health technologies regulation, pre-qualification regulatory systems, strengthening and safety activities, fundamental for safe medicines. And you also lead assurance of quality, safety and efficacy. Really, I mean, this is so close to pharmacy's heart. But very recently, it was announced that you are the first woman to head up the European Medicines Agency, its 25-year history, take the reins as the EU reckons with possibility of increased health powers. Before we get into all of that and your career path to date, Emer, just wondered if you could share with us a little bit about the journey before you started pharmacy and left Trinity College Dublin with a master's degree in Science and Business Administration. Can you tell us a little bit about your childhood and how you chose your career, Emer?
Yes, indeed. Well, it seems like a long time ago at this stage, but as you said, I'm an Irish national. I actually come from a rather large family, not by Irish standards, but probably from the standards of most of your listeners. I am one of 7 children, and I have 5 sisters and 1 brother. And we all were, my father was an engineer, my mother originally was a dental technician, but all of the 7 children are relatively high achievers. So it's been an interesting environment to come from. And I went to a very good school, an all-girls school in Dublin, and then subsequently decided to study pharmacy. And maybe just a little bit about why I decided to do pharmacy. And it's probably not a reason that most of your listeners will have made their choices based on. But about 40 years ago in Ireland, we were in the middle of an economic crisis, and there was also a very high unemployment rate, and there was a shortage of pharmacists. And I was afraid I wouldn't get a job. And I thought that at least if I studied pharmacy, I would get a job. And that was my main criteria for doing pharmacy at the time. And what is ironic about that is that the jobs, of course, were community pharmacy. And I only worked very briefly as a community pharmacy because that's where the gap in the market were. But I subsequently went on to work in regulation and government affairs. And I did some work in R&D as well and worked as a pharmaceutical assessor. So I went into pharmacy for all the wrong reasons, I would say, but I found my calling in regulatory affairs and the sort of link between the technical scientific world and the policy and legal world of regulation.
So that's really interesting to me, Emer, that you can reflect back and think maybe the motivations weren't quite right, but you've made something out of it, which really seems to play to your strengths. And I just wonder whether anybody else in your family had gone into health over those years. Do you have anybody else who is involved in medicines or medicine or nursing or anything?
Actually, no. I've got engineering, architect, philosophy, IT, languages. More recently, one of my sisters has qualified as a psychologist, but she originally did IT. So no, there was no real background in that area other than the sort of scientific engineering architect background.
Which is kind of where you leaned then, moving into regulations and safety and such like. I mean, it's really interesting, isn't it, that you do kind of see some of your environment as you make your choices in the very beginning. Very interesting. Yeah, I come from, yeah.
I would say is that pharmacy is a wonderful degree because it's very broad and it doesn't, you're not a specialist, at least to start with, you're not a specialist in anything, but you get a grasp of a really wide range of topics, which means that when you find something you like, you have something to go on and something to work on.
I think so. I think actually, Emer, if you look at the profile that our community colleagues have had during COVID globally, access to medicines and healthcare advice, it's second to none. But then you look at every single place we occupy across the medicines journey, and pharmacy is really essential. And you can, from your degree, you can have a springboard into any of those areas. It's really interesting. Yeah, I'll come back to that with you throughout, Emer, I think. Moving on then, Emer, I've been so impressed to have a little peep at your CV and your career achievements to date. I see you obtained your degree in pharmacy from Trinity College Dublin in Ireland and a master's in science also from there, specialising in pharmaceutical chemistry. So again, that science thread weaves its way through. And then you took on a number of positions within the Irish pharmaceutical industry before joining the Drug Regulatory Authority as a pharmaceutical assessor. Again, there's this safety element weaving its way through. And then you joined FPA as a manager of scientific and regulatory affairs. And from then, the European Commission, and then the European Medicines Agency as head of sector for inspections. And then 2008, you were appointed to a newly created position of International Liaison Officer for EMEA. And I can see from there, you've moved within the organisation. How many lessons? Now, we know, you and me, Emer, when you take a step back and have a look at the CV can really list an awful lot of achievements and it makes sense when you look back at it. But what would you say were the 3 biggest lessons of your career?
Well, in terms of the biggest lessons, I think one of the things I find very, very important is I need to do something that I love. And it took me a while to find exactly what I loved. But when I found it, it made such a big difference. And I would say my big personal career break was in 1992 when I took the role of Manager of Scientific and Regulatory Affairs in FBI. Completely, I had no idea what that job would entail, but I had a very demanding and visionary female boss, Nellie Baudrier, and she became my mentor. She taught me more than she would ever know, and really gave me a stepping stone into the world of European affairs and regulation. And I found that I loved it. I loved helping to make European countries and companies work better together. And I was quite good at it. And it was something that it's not a career path that you would normally think of, but I got the opportunity and I took it. So one of the lessons I would say is, if opportunities present themselves, be open, and you will find something that suits you and that works for you. In terms of other lessons that I've learned, and maybe this is, it's linked in a way, because I would say that career development for me has been more about luck and opportunities than good planning. Because if I had started to plan my life back when I started my postgraduate career, I would have had, I didn't even know that these opportunities existed. And it was only when I got from FPA to the European Commission, then the EMA was a new starter at that stage. So I was looking at the whole European regulatory framework. And if I had stuck to my original planning, I would never have got there. So I think it's very important to be open, to look at, to consider other opportunities. Of course, it's not for everybody, but these things really had an importance in my life. Other lessons I've learned, well, one of the really practical lessons I've learned is that when you're angry or annoyed and you get an email and it bugs you, don't reply. Wait until the next day. You're going to be much more sanguine about it and much more diplomatic in whatever you're going to say, and you can make exactly the same point, but without anger or annoyance behind it.
Such good advice there, such good lessons, Emer, I have to say. And I think that plays a little bit, the final one plays a little bit into the diplomacy you have probably learned over the years. So what I've taken from that is you found something you've loved because you took some opportunities. And if you'd fixed yourself right at the very start to a career path that someone else may have suggested to you, you wouldn't have been able to do that because you wouldn't have been faced with those opportunities. So there's something for our profession, maybe some of those starting out right now, not to fix your past too early or maybe ever, because we don't know what's around the corner and you don't know what you might, how would I say, what you might be good at, would you say?
Absolutely, absolutely. As I said, when I left Ireland in 1992, I hardly knew some of these institutions and organizations existed. And it's just, as you develop your contacts, as you develop your interfaces, you learn more and more, and you learn, what you can do or what you're good at in these contexts, which obviously it's difficult to know until you actually are interfacing with the organizations in some way.
I think so. And I also think that sometimes when you're at the start of your career, people would say, well, if you go into hospital or community or into industry or academia, you can do X, Y, Z. Some of the institutions you started off in, Emer, were quite new at that time. So maybe there's an opportunity for people to be thinking, try something that is fairly new in its inception, and that gives you an opportunity to shape it as well as be shaped, maybe. Could be a good observation.
Yes, absolutely. I think I've been very lucky in that one of my motivations for going from Ireland was because at that time I was thinking about the regulatory framework, and I didn't know what the new procedures were going to entail, but I was thinking, you know, if I stay here, I might end up doing, I thought the exciting work was going to go on in a European setting, and I thought I wanted to see if I could get involved in that in some way. Now, in the end, that wasn't true. I mean, the Irish Regulatory Authority does lots of exciting work, but at the time, we didn't know how it was going to pan out. And that was really one of the reasons why I sought to go beyond Ireland at the stage.
So, Emer, this is very interesting because you mentioned the 40 years ago, there were very big pressures in our profession. I'm not sure the pressures will be the same in the profession, but we're about to exit a global pandemic. As and when that comes, we know that we're going to be facing very big challenges. So I think people listening to this interview who may be at the start or even at the mid of their career might just be putting their ears back to listen about taking a sensible look at the jobs market, and then building on that really is important, isn't it?
Absolutely. And I think particularly for pharmacists now, there's a real opportunity to show added value in the community and hospital settings as well as in the industrial and regulatory settings. I mean, I see my friends and colleagues really being such an important part of the healthcare setting in the pandemic situation. It's really frontline work, and tiring, difficult, but also rewarding in a lot of different ways.
So rewarding, Emer, I have to say. Well, we'll move on, but we'll come back to that when we reflect on our profession, when you're in either European or global positions. I think it's a really good point to make. But Emer, we're now moving into, you know, all of the positions of seniority that you've held. As we've gone through, you have 30 years experience in international regulatory affairs, 18 of which are in leadership roles. You worked for pharmaceutical unit of the European Commission and at EMA, and you've held positions including head of inspections and head of internal affairs. But most recently, Emer, the EMA Management Board has nominated you, sorry, I'm tripping over my words here, as the new executive director of the agency. And you're the first woman to be appointed to such a role. I would just ask you, Emer, now, whether that's one of them or not, what are the 3 biggest achievements you've had to date?
Thank you. Well, I sort of was expecting this, but I'm not sure I call this an achievement yet because I still am formally formally in my role. But I can tell you, getting through the process has been an achievement in itself. It's I mean, especially for somebody like me, late career, going back to multiple interviews and assessment sessions, and what ended up being a remote interview with the health commissioner of the European Commission, and then with the EMA Management Board. It was an amazing experience, and I've also just 2 weeks ago now, I had a hearing in front of the NV Committee of the European Parliament. Again, totally new experience for me. So I think I would say it's a fantastic achievement and opportunity, but I'm not there yet. So I can only talk about the process of getting there.
I'll give you that one, Emer. It's an achievement to be the first woman to get through this role, and in such times when, as you say, it's all done remotely. Yeah, I know you're going to have many more achievements in that role. That aside, what would you say, achievement-wise, you are most proud of?
Well, I think if I talk, actually one of the interesting things is I've had to think a lot about my achievements over the last year or so when I was going through this process and trying to pick out the ones that were going to resonate with whoever was interviewing me at that particular time. And it's funny, I'm actually proud of of many of the achievements I did as a young professional, as well as being proud of the ones that I have done recently. So I thought maybe I would focus on two that are recent, and maybe two that are, I guess, maybe 25 years ago at this stage. But there are similarities, I think, and the one I would like to focus on now is the achievement of developing a vision and regulatory strategy for the WHO, for my teams within WHO. And this may not sound such an achievement, but in fact there haven't been a regulatory strategy across WHO before this, and the groups had been through various iterations and various organizational structures, and it was quite hard to develop a common vision. But I could see that a lot of people were doing similar activities, and they needed to work together better. So I put together a group to try and develop the strategy, and really to make us more coherent, more efficient, more planning and monitoring focused, so that we can serve the countries better. Because what WHO is about, serving 194 member states in completely different regulatory environments than probably the regulatory environment that I would have been used to before I came to WHO. So this took about 1.5 years, but in July of last year, we launched our regulatory action plan with 4 strategic priorities, and we have been working well in terms of the objectives and deliverables. And I'm really proud to have it down on paper and to be able to showcase the work that my teams are doing and what difference they're making. The other more recent achievement I wanted to talk about was the launching of a pre-qualification pilot program for biosimilar cancer medicines and for insulin. These were 2 different pilot projects, but the idea behind these was that until then, WHO pre-qualification, which is essentially an assessment and inspection activity, had focused on medicines for HIV, TB, and malaria, and vaccines. But the world was changing, and there was really a need for lower cost biological products. And the idea behind launching this pre-qualification program was to make biosimilar medicines and insulin more accessible to countries and patients that needed it. And we have been very successful in launching this pilot and again pre-qualifying, making sure that they're safe, of high quality and effective, and that they reach patients in countries throughout the world. So there's 2 examples from my recent career. 2 other examples from my past career were actually when I was at the European Commission. I came in to work as a in the pharmaceutical unit, and I was asked to support my boss on the Orphan drug regulation. And it was at the stage when it was going through council and parliament. So it was a brand new piece of legislation. It was really innovative in its time. It was the first time that there were patient representatives going to be on any scientific committee involved in the regulation of medicines. So there were a whole lot of new ideas in this piece of legislation. And about 6 months into my employment with the European Commission, my boss left and said, now you take this over. And I had never been responsible for a piece of legislation in my life. And of course, I wasn't senior enough to be really responsible to move it through, but I did all the background work. I met with all the committees. I met with the interpreters, the juris linguistes. I organized a process to get, to make sure we had an equitable way of having patient organizations on the Committee for Orphan Medicinal Products. So there were a huge number of new things that needed to be done by somebody who at the time had very little experience in this area. So I really see this as one of my achievements, that I was able to jump in and to take over the baton from where my boss had left it, of course with the support of a lot of other people. But ultimately, they were looking to me to make sure it kept moving. And then the final achievement I'd like to mention is the setting up of the Pan-European Regulatory Forum, which was a process or a network whereby acceding countries to the EU would work together with countries who are already in the EU to make sure that they were prepared for accession, to identify the priority areas where they might need support or they might need to develop new legislation. So I put a concept paper together on putting this Pan-European Regulatory Forum, which was originally a very small idea, just trying to get existing member states to work with acceding member states. And it ended up being a multi-million euro project that had three cycles, and it really helped to prepare the accession of the 10 new countries that were coming into the European Union in 2004. And again, the reason I see this as one of my biggest achievements was because it was completely new ground at the time, and it was an idea and it worked, and I've used bits of it since then in other contexts.
So, Emer, they're just great examples. You've really given us a range here. And what I see is someone who's a bit of a pathfinder. You have mentioned in these examples the idea that you would take responsibility, rising to the challenge, taking on the baton. And that really fits into one of the lessons you gave us at the start, which is about taking the opportunities as they're given to you. But additionally, there's a very strong notion coming through your examples there of doing what's right and doing the right thing. And again, reflecting on your team and showcasing their work. So you make a really strong mention throughout that none of this is done alone, that you really had support and had the right people in your team as well. So I see this very much, you're giving us examples of practicing what you preach in the lessons that you gave us right at the start of the meeting itself, and taking those opportunities. And my final reflection back to you on those achievements, things you're most proud of, is the vision and regulatory strategy for WHO that you delivered last year. I can see that each thing that you've done throughout your career builds a skill set that you then draw on for later and draw on in a team working way. And I think that's a huge lesson that's shining out, and people who listen to this interview will get that really loud and clear. Absolutely fantastic. Thank you. I don't know whether I've summed it up right, but when I've been listening to you very carefully, this is what's shining out for me.
Well, thank you very much. That's a very nice reflection. I appreciate it.
Not at all, not at all. I think there's a lot of overlap between this and our next question, and I'm going to give you a limited list if you need it. These don't necessarily have to be related to work totally, but more characteristics, if you like. What are the 3 things alongside that portfolio of achievements you're most proud of?
Yeah, so I think the ones I've mentioned, I'm very proud of those for a number of reasons, and mostly because I'm quite sure that they wouldn't have happened, or they wouldn't have happened then, unless I had pushed and helped make them move. One of the other achievements that I'm very proud of, and I don't take responsibility for, but it was an achievement with a lot of different collaborators at a lot of different times, and that is the mutual recognition agreement with the US FDA on recognizing GMP inspections. And I have to say, I was involved in the MRA discussions from the time I was in the European Commission. When I was head of inspections at EMA, I was working again with FDA, and we were not really going anywhere. There wasn't good willingness on either side, and it wasn't until quite late, I would say 2013, 2014. Now, just remember, this is something I started working on in 2002, that we saw that there was a change, and that maybe there was a more openness on the US side to see how we could work better together. This was also combined with the fact that I'd done a lot of work on international collaboration with FDA and the US and a number of other countries at the time. So I knew a lot more than when I started off in 2002. But I think that the reason I'm proud of this is because I could see that things had changed, and now was the time to do it. It wasn't, if we lost this opportunity, it wasn't going to happen. And I had a number of like-minded colleagues at the Commission and at the US FDA, and we basically strategized and created an environment that allowed it to be successful. And we brought in the people from all sides to really help to make it happen. And I think one of the dates I find, it actually happened after I left the EMA. So I was already at the WHO when the US-EU mutual recognition agreement was signed. So I didn't get right to the end, but I do feel I had quite a big role in helping to make it happen.
I think that's a worthy one to be super proud of. And I have to say, you know, sometimes our biggest legacies are what we leave behind rather than seeing things to completion. That's a top tip to give some of our youngsters in the profession, really. That's such a powerful thing. What tenacity you had, Emer, really, just to keep your nerve and to keep knowing it was the right thing, that theme coming through again. Thank you so much for that one. Really valuable. So, Emer, I mentioned at the start of our interview how important it is for us to share things with our next generation. I've been weaving, as we've been talking through all the way, how our young professionals could learn from some of your lessons. But do you have any top tips you could share with the next generation of pharmacists or pharmaceutical scientists?
Yeah, I think one of the things I have learned throughout my professional and personal life is you have to listen to everybody. You don't just listen to the people above you, you listen to the people beside you, and you listen to the people who report to you, because everybody has a different perspective. And the only way to get something that will work within all these perspectives is to understand where these perspectives are coming from. And I would say one thing that I learned a little bit late, because I was very lucky and I had a lot of older mentors who I still have, but after a while, they retire and they can't help you anymore. And you look around and you go, well, I don't know the next generation as well as I knew the previous generation. And you have to start building new relationships. And I think I would have done that a little bit differently if I had realized that I couldn't always rely on my mentors. I needed to also make sure that I was listening to the new generation that was coming up. So I think the message I would say is that whatever context you're in, that's the context today, but you need to think about what the context tomorrow is. And so if I think about now, I mean, I don't know enough about social media. I don't know enough about how, other than for my children, you know, how to interact in today's digital environment. But that's a skill that other people can teach you, or other people are better at, and because they have that different environment. So I think you need to be looking at the things that you're good at and the things that other people can bring to the table that maybe are not that are not really your skill set. One of my big messages really is to be open to new ideas and open to change, because if you want to do something you love, and if you know what makes you happy, you need to be able to embrace the opportunities that present themselves. What else? I think you just have to keep learning. That's the other thing, that, you know, you think, I'm nearly 60, and I would say I'm spending 20% of every day learning new things. And when I stop doing that, I'm going to be very, very sad. So keep learning, keep open.
And maybe the current environment we're living in, Emer, encourages us to keep on our toes a bit more, because it seems to me as though things we know now are very different about COVID to what we knew 3 or 4 months ago, even though there's some core principles that run true. So it's a really good point. Yeah, I don't think you'll ever stop learning, Emer. I have to tell you, I don't think you'll ever stop.
No, but with COVID, I mean, that's been such a learning experience. And if you look at the unprecedented development of particularly vaccines, but also of repurposed medicines, and then how to make sure that we take advantage of the ones that are most likely to deliver benefit, and how we adapt practices to be more flexible in a situation where actually we don't know enough about the disease.
Yeah,
we're still learning, and you know, we're trying to adapt to uncertainty all the time. And one of the things that I've heard from many of the experts that I have the privilege to deal with is that, you know, people who say they know and they understand this virus, well, we're not there yet.
They'll understand it today, but that might be different, you know, in a week's time. I couldn't agree with you more, Emer. And isn't it striking that we're doing this in a very collaborative way? There's two contrasts, isn't there? There's some of the politics we're seeing, which can be quite divisive and singular, and then some of the practices we're seeing, which is so collaborative and uniting. And I think we can be inspired and despairing at the same time with some of the things we're seeing. Very interesting. I still see some themes coming out from your top tips, which include do the right thing, look at today and tomorrow, prepare and learn, be open to change and opportunities, Emer. This definitely defines the Emer that I have in front of me today. So we're moving to our last question, last but by no means least. This can be anything, but, you know, throughout our professional lives, we have to build and adapt and grow, and then never more so as in these times in COVID-19, professionally and personally. Do you have any things you'd like to share that have become essentials to your working life during COVID, particularly, Emer?
Well, when in pre-COVID days, I used to say, and I often say it to when I'm giving talks to younger generations, I used to say never live more than 30 minutes from your workplace, but I can't say that in COVID because my workplace tends to be where I live. But I think the adaptation on that is that really try and separate your work and your life, because I'm finding it even more stressful to be sitting in front of sitting on video all day than I would have been if I'm in the office. And you do get different breaks, even if you're doing the same amount of work and you're doing the same number of hours. I have to say you really need to make the effort to separate business and pleasure. I still, in COVID and non-COVID times, I think it's essential to do something that you love. You spend a third of your of the hours of the day, at least a third at work, and that's a big amount of time to do something that you don't like. And I have to say that once I found what I liked, I have never minded the number of hours I've worked. I never even noticed it. I just enjoy trying to make a difference and make sure that we do the best that we can in this case for our WHO member states. And then the third thing is, and this is, everybody laughs at me at this, but I still get dressed up to go to work. I start my working day in front of my computer exactly like I would start my working day if I was going into the office, except for my shoes. And that's a real regret for me because I love high-heeled shoes. And I haven't had an opportunity to wear high-heeled shoes for quite a while now.
Emer, I'm really wondering about how we're ever going to get back into our high heels again. It must be said. No, really, really good. Somehow it's like putting on the work, and you're quite right, to be able to separate the work-life balance, to be able to put on your work clothes kind of gives you an opportunity then to change into some more casual clothes at the end of that working day. Very, very handy tips there. Emer, what an absolute pleasure and an honour it has been to talk to you. I hear a woman who is driven to do something you love, but to do it in the right way, to take your team with you, to learn as you go and never stop learning, but to bring things from early in your career to now. And you sound like you're super proud of the achievements that you have had with your team, which I think is something that we should inspire our younger professionals to feel. I'm really, really proud of you being the first woman appointed in the new role. And I know I speak from all of my pharmacist colleagues, but also all of my Irish pharmacist colleagues as well. Congratulations, we wish you well. And please know that FIP is behind you and stands with you shoulder to shoulder, Emer. It's a total pleasure speaking with you. I don't know if you have any mini reflections yourself.
No, just to say thank you for the opportunity. I really enjoyed it, and I look forward to continuing to work in FIP, no matter where I am, in whatever role.
Perfect. There's a lot to do together, Emer. We need you. Thank you so much, Emer. Thanks a million.
Thank you. Thank you.